Please welcome Sir Michael, who will now address us on social justice, health equity, and sustainable development.
It's always a pleasure to be in New Zealand, but something about this historic moment makes it extra special to be here. New Zealand, for reasons none of us would have wanted, is now on the world map for the wrong reason. Lots of good reasons for New Zealand to be there. So it makes this a very special moment to be talking about social justice and health. The opening line of my book, The Health Gap, was what good does it do to treat people and send them back to the conditions that made them sick? I don't need to tell this audience about how important the conditions that lead to illness in the first place are. We heard in the introduction a warning about earthquakes. Here is an earthquake. This is life expectancy in England. I've done it from 1980, but in fact, if we went back to 1921, between 1921 and 2011, life expectancy improved 1 year every 4 years, 6 hours every 24 hours. That's amazing. And then in 2011, it stopped and leveled off. If you agree with the proposition that health tells us something fundamental about how well a society is meeting the needs of its members, then something is going terribly wrong. And in a way, the government in Britain knew that because they got very defensive about this. A year after we published those data, a couple of months ago, thank you, a couple of months ago, these data were published, and you can see that the life expectancy rise more or less ground to a halt in England. Life expectancy went down for men in Northern Ireland, essentially. And when we look at inequalities, these are deciles, small areas classified by deprivation. And you can see, particularly for women, in the more deprived areas, life expectancy is going down. The social gradient is getting steeper. When I wrote about this, I looked across the Atlantic at the US and asked, is this our future? I was sitting in Hong Kong in November and got a phone call from the BBC World Service in London. That day, the news had come out that life expectancy in the United States had declined for a third successive year, 3 years in a row, unparalleled. Something is going terribly wrong. And that orange nightmare in the White House knows nothing about it. Now, Trump didn't cause this, but in some sense, this caused Trump. The number one of the increase is unintentional injuries, which includes accidental poisonings due to drug overdoses. 63,600 deaths, and in 2017, it was 70,000 deaths. People were either committing suicide, taking drug overdoses, or voting for Trump. There seemed to be alternative. Maybe some of them were committing suicide and then voting for Trump. And I mean that because the geographic distribution of these deaths was in the Midwest and the more deprived areas that were where the Trump vote was. Something's going dramatically wrong. And I talk about the gradient. This graph shows life expectancy at age 50 for men by deciles of income. So look at 1920, year of birth. People who were born in 1920 will be 50 in 1970. And you can see the gradient, the lowest decile of income, lower life expectancy, and each decile has higher life expectancy than the one below it. Now, go forward to birth 1950, people will be 50 in 2000. Life expectancy barely went up for men in the bottom decile of income. And then for each decile of income, the higher the income, the steeper the rise. So the social gradient got much steeper. The inequalities got bigger. This is men. We've just had our little bit of meditation and we're relaxed. I don't want to upset all that so early in the morning. Are you ready to see the next slide? I think I ought to get informed consent before I show you the next slide. This is women. Exactly. Oh my God. Life expectancy is going down for the bottom decile. It's going down for the second bottom decile. It's going down for the third bottom decile, the bottom 30% of the income distribution. Life expectancy for women in the United States at age 50 is declining. And the social gradient's getting steeper, the inequalities are getting bigger. And I look and say, is this our future? If you come back into this room at 1:45, you'll hear about the Americas. I do have a global perspective, but in this presentation, I want to focus on the fact that in rich countries, things can go very badly. What can we do about these problems? Well, in the WHO Commission on Social Determinants of Health, we laid out the evidence on social determinants, and we said on the cover of the report, social injustice is killing on a grand scale. In the light of the WHO Commission, I was invited by the British government to ask how we could apply the recommendations and findings of the Global Commission to one country. I produced the so-called Marmot Review, Fair Society, Healthy Lives, and we were then asked by the European region of WHO to look at social determinants and the health divide in Europe. These were the 6 recommendations from my English review. Give every child the best start in life, education and lifelong learning, employment and working conditions. Number 4 that I want to talk a bit more about. In a rich country, everybody should have at least the minimum income necessary to lead a healthy life. Number 5, healthy and sustainable places to live and work. And number 6, taking a social determinants approach to prevention. And as I said, you'll hear this afternoon, the outline of our report of the Commission of the Pan American Health Organization on Equity and Health Inequalities in the Americas. And we call it Health Equity and Dignified Lives. Create the conditions for people to lead dignified lives, and health will improve and health equity will be enhanced. And in the Americas, we've been very concerned about health of Indigenous people. I talk a lot about socioeconomic differences, but if we look at non-Indigenous, Indigenous infant mortality, in each of these countries, no matter how low the infant mortality, Indigenous people still have higher mortality than non-Indigenous. And at older age, look at people aged 65 and over in receipt of a pension by Indigenous identity and educational level. And you start to see intersectionality, that Indigenous people are less likely to be in receipt of a pension than non-Indigenous, and particularly that is the case for those with low education. So it's multiple disadvantage. On recent trips to Australia, with my colleague, Fran Down. Did I see Fran over there? With my colleague, Fran Down. We've got interested, well, Fran's been interested for a long time, but she got me interested in the poor health of Indigenous communities in Australia. And with Fran, we went to the Northern Territory last time, well, back in May. We went to Alice Springs, which looks like the Big Smoke compared with downtown Arayonga, 2 hours drive from Alice Springs. This is downtown. We went to the health clinic, and they're very proud of the fact that they've got health promotion advice to prevent obesity and diabetes. Eat more fruit and vegetables. We're in the middle of the desert. Do you know how much an apple costs in Alice Springs, let alone in Arayonga? How are people supposed to follow health promotion advice if they have no money? And in Alice Springs, the biggest building that looms over the whole town is the courthouse. The incarceration rate for Indigenous Australians in the Northern Territory, 2,400 per 100,000. For non-Indigenous Australians in the Northern Territory, it's 186, a 13-fold difference. 84% of the prison population is Indigenous, compared with 27% of the general population. And diagnosed mental illness in prisoners, 72% in males, 92% in females. What a place to put damaged young people. People with mental illness. Lock them up in prison. Can you imagine a worse thing to do? And if indeed having mental illness makes you more likely to get into prison, then if we want to prevent incarceration, we should prevent mental illness. And there's a great deal we can do in early life. We need to make common cause. Investing in early childhood will get better health later in life and lower incarceration rates. So, give every child the best start in life. We've been looking in England at adverse child experiences. So I went to Northern Territory with Fran, then in Sydney and Melbourne met various Indigenous community-controlled healthcare organisations. And if we're worried about adverse child experiences in England, they indeed are worried about adverse child experiences in Indigenous communities in Australia. And you can see that each of these adverse child experiences is more common as you go down the social gradient. It'd be quite a good idea to reduce inequality and reduce poverty. All of these problems, physical abuse, psychological abuse, sexual abuse, drunkenness, drugs in the parents, incarceration and the like, all more common as you go down the social gradient. So what have we been doing in the UK to reduce poverty? Not much. This is the risk of being below the minimum income standard. For individuals in households with children, just under 31% in 2008-9 were at the poverty level, and 2012-13, sorry, it's mislabeled, it had gone up to 39% of families with children were in poverty in a rich country. And characteristics of housing and neighbourhood matter for health. Housing is a poverty issue. In London, if we look at childhood poverty, where poverty is defined living in a household at under 60% of the median, before housing costs, 17% of children are growing up in poverty. After housing costs, 37% are growing up in poverty. Poor people can't afford decent housing, and the cost of housing is making people poor. It's very rare that you can make a close relation between a particular policy and a social outcome. But the policy of selling off social housing has had dramatic effects. In London, 38% were in social housing, it's now 23%. And private rentals have become unaffordable. And people living in expensive housing can't afford to heat them. Cold housing negatively affects children's educational attainment and mental illness in children. When I was at the British Medical Association, the chair of the council from Edinburgh, I can't do his Edinburgh Scottish accent, but he said, oh, you know, when I was a lad, I can't believe this stuff about cold homes. When I was a lad, we had ice on the inside of the windows. And I said, Hamish, imagine what you might have achieved if you'd grown up in a warm house. There was an exhibition in London, Bedrooms of London. My demise as a serious scientist is now official. The Lancet sends me off to do reviews of photo exhibitions. I wrote a review of this photo exhibition. This is what it's like in people who are homeless. Emily, Mark and their babies sleep on the sofa bed in the living room where they eat. The other 3 children in the bedroom. Martin is employed. He earns £800 a month. But that's all they can afford. Outside, the older kids compete for drugs, clientele. They leave knives in the bushes where younger children play hide and seek. So the mother doesn't want the children to play outside. They stay in this crowded room. In this one, there were 3 teenagers and a 9-year-old in one room, and mum and dad in the other. Both parents work. So this is not people who are subsisting off the state because they don't feel like working. They're working, but they don't earn enough to afford decent housing. And they say, the area is full of gangs, said the mother. I want my children to live in a safe place. There are kids around the building who don't go to school. I call this one everything and the kitchen sink. Look at the signs. To get from the bed to the door is perhaps one step. The bed, the cot, the kitchen. Emily's partner left when she was 5 months pregnant. She said, at the beginning I didn't have benefits, so I didn't have food. I was crying for no reason. Crying for no reason. She puts a towel under the door to stop the weed smoke from getting in. In the hostel in which she lives with her baby, that's the only child. And everyone else is smoking weed. A Nigerian mother, English father, and 3 children in a 2-bedroom flat. The mother said, to know that somebody, somewhere, is making something available for you to be happy. My feeling welcome in this country has been all through charities. Are these feckless women choosing the easy life of welfare dependence? As one mother said, nobody falls into this on purpose, because your whole life is going to be a trap. And then you'll see yourself living a life you never thought you would. And we tell people to eat healthily. That's part of the good health promotion advice, eat healthily. If people in England follow Public Health England's healthy eating advice, those in the bottom decile of household income would spend 74% of their income on food. And in Scotland and Wales, it's rather similar. 67%, 74% of their income on food. Who's going to pay the rent? Housing is a food issue. I interviewed one mother. She said she would go shopping to feed the family, and she would buy a packet of dry pasta, of dry spaghetti for 40p, and a can of tomatoes for 40p, and that was it, the family meal. And if you heat the house, you can't pay the rent. If you pay the rent, you can't heat the house or eat. These are the choices people are having to make. It's not all bad. The city of Coventry declared itself a Marmot city. They've taken my 6 recommendations that I put up before, and they said that's the basis for our city planning. We're now working with Manchester. I went to see the mayor, Andy Burnham, of Greater Manchester. He said, could we become a Marmot region? Why not? So we've just signed a contract to work with them for the next year to use our 6 recommendations as a basis for plaster. I think you may have already got a glimmer of this at yesterday's meeting. I found this quote: a well-being approach can be described as enabling people to have the capabilities they need to lead lives of purpose, balance, and meaning for them. Where might that have come from? Amartya Sen? Yeah, could be. Well, in fact, it comes from the New Zealand Treasury. Thank you. Wow! That's amazing. The Treasury in the UK says, where can we cut? Whose benefits can we cut this week? Can we cut the police? Can we cut the legal service? Can we cut the prisons? Can we cut local government? Can we cut... All what we've got to do is cut. And here is a government that says a well-being approach which enable people to have the capacity to live lives of purpose, balance, and meaning. Wow. My 2 messages in a world of post-fact politics is evidence-based policy presented in a spirit of social justice. Remember, we said on the cover of the WHO Commission report, social injustice is killing on a grand scale. And now I'm going to do the unpardonable and quote myself. At the end of the WHO, the PAHO Commission report, we said at the heart of the Commission's report is ensuring the right of all people in the Americas to lead lives of dignity and enjoy the highest attainable standard of health. We call on all governments to act. We can make a difference. Thank you.